Welcome friends, this is another interactive session from Starcare, and this time it is a pleasure to invite Dr. Ajitha, Senior Consultant, Laparoscopic Consultant from India. Doctor, it's a pleasure to invite you here. Welcome to Starcare. Doctor, welcome you on board. We would like to know about yourself.
Thank you so much. I am Dr. Ajitha. I am from Calicut, Kerala. I did my graduation and post-graduation from the reputed Calicut Medical College. It is one of the premier institutions, and I would say it is the college where maximum number of deliveries occur in Asia. Later, I had my laparoscopic surgeon under the guidance of Professor Rajan, and then went to Keele University where I had further training.
Doctor, what are your interests in your area of specialization?
Named as an obstetrician and a gynecologist, my area of interest is mainly infertility and laparoscopic surgeries.
Dr. Ajitha, what is laparoscopic surgeries and what do you think are its advantages?
In laparoscopic surgeries, we view the peritoneal cavity through a laparoscope. That is, the camera is inserted, scope is introduced into the abdominal cavity, and the whole thing appears on the monitor. And the surgery is performed using the monitor, and small additional ports are put to the instruments which are used in the procedure. And as you see, there is no big incisions as we do in an open surgery. It is just a very small incision, and for cosmetic purpose, most of the cases it is through the umbilicus that the initial incision is made, and the other smaller ports through which you pass instruments are made in the lower abdomen, and they are very small so that we needn't even close those sutures. So the advantage is that because there is no big scar, there is no pain. Actually, the pain is minimal. There is speedy recovery and reduced minimal hospitalization, because the patient, most of the surgeries are done as day care surgeries, and the patient is discharged on the day of surgery itself, or if they are needed, if it is some case like hysterectomy or any other operations, maybe they will have to stay for 1 or 2 days. So there is a minimal hospitalization, and the patient is back to normal very soon, because after the surgery, the patient takes her oral feeds 4 hours after the surgery, and she is up and about immediately after 4 hours. So there is no need of any additional person to support her, and because there is no big scar, there is no chance of wound infection. There is also very much less. I would say complications are very much less, or even nil in experienced hands. Of course, laparoscopy has got a very steep learning curve, but then once it is mastered, I would say I would always prefer laparoscopy to open surgery.
Doctor, what are the common surgeries done through laparoscopy?
In the initial stages, when laparoscopy was started, it was used mainly as a diagnostic tool. But now, I would say all surgeries done through by open method can be done laparoscopically. Like a diagnostic laparoscopy, when you have a case of infertility, you have to know any pathology in the pelvis to inspect the uterus, and the external surface of the uterus, the tubes, the ovaries, etc. can be done by laparoscopy. And to inspect the internal cavity of the uterus, that is, the uterine cavity can be inspected by hysteroscope. The hysteroscope is a camera that is introduced into the uterine cavity to see the inside of the uterus and also to visualize the opening of the tubes. So any abnormality inside the uterus can also be corrected. And the other purposes for which it is used by it is the laparoscopy is used for surgeries of the fibroids of the uterus. That is, over tumors in the uterus known as fibroids. For any cysts and tumors in the ovary, and any ectopic pregnancy, that is tubal pregnancy, then tubal recanalization, sterilization, and also for any additions, ediciolysis, just to name some of the surgeries that are commonly done through laparoscopy.
Doctor, what is the common cause for the removal of the uterus?
The most common cause for which the uterus is removed is for fibroid uterus. That is, fibroids are tumors of the uterus, and they present in different ways. And fibroids can be inside the muscle of the uterus, or it can grow outwards when it will not cause any symptom, and very often the patient comes with a mass in the abdomen. Sometimes the fibroids will grow into the uterine cavity, that is what we call the submucous fibroids, and these fibroids can be symptomatic. They can cause excessive bleeding during the periods, and sometimes when it grows down and becomes a pedunculated fibroid, it can cause intermenstrual bleeding, that is bleeding in between periods. And these submucous fibroids are also the cause of infertility. But when a woman who has completed the family, and when she presents with multiple fibroids of large size, very often we resort to hysterectomy. But all fibroids are not removed by hysterectomy. because in case of a person who wants to preserve the uterus or who wants to preserve fertility, in those cases we remove only the fibroids, and that is known as myomectomy. Another cause for which the uterus is removed is dysfunctional uterine bleeding, where the person presents with excessive bleeding, which you may not find any cause for the bleeding. There may not be a fibroid or any other lesion. So this could be due to some hormonal imbalance, or it could be a condition called adenomyosis. And when this is not taken care of by medical management, we will have to resort to hysterectomy.
Doctor, you had mentioned about tubal recanalization. Doctor, what is it all?
A tubal recanalization is a procedure that is done to reverse sterilization. It is during sterilization, that is when they want to go for the family planning, the tube is cut, a small portion of the tube is usually cut, or sometimes we use the fallope rings where a loop of the tube is put inside a ring. So the tube is blocked. So to remove that block, we do the tubal recanalization. When doing a tubal recanalization, we just freshen up the two cut edges so that you see that the patency is there. And once the patency is established, we just suture the two ends together in a very particular fashion in 2 layers. So that after the procedures are over, also we check the tubal patency, and that if the tubes are patent, there is a 20 to 30% chance that she might conceive. Even though it is only 20 to 30% chance, without the procedure it is 0%. And once this procedure is a success, it is a permanent method. We don't have to go for it every time. Nowadays, because we have this test tube baby treatment and all those things, but sometimes I get patients who come after, that is, they would have had 2 or 3 children and they would have gone for sterilization, but one fine morning they decide they want to have one more child, and they are not willing to shell out money for IVF for any test tube baby treatment, so they just want to give this a try. So this patient should be told that success is not 100%, but still when it is not done, it is 0%. When it is done, it is about 20 to 30% chances. I have had about 6 to 7 pregnancies after tubal recanalization.
Doctor, tell me on what symptoms does a woman consult a gynecologist?
The most common problem with which a woman comes to the gynaecology is bleeding per vagina. This could be an excess bleeding during periods, or it could be either scanty bleeding, or they may have periods of amenorrhea, that is 1 or 2 months without menses and then they have a heavy bout of bleeding, or they can have amenorrhea for months together, or in between periods they have bleeding. And the cause for this depends on the age group. In a young girl who has recently menstruated and she comes with an irregular bleeding or excessive bleeding, it could be because the hormonal status has not been well established. So it might take a few cycles for her to re-establish, so that you make sure that all the other parameters are all normal, like thyroid is normal, she has no blood dyscrasias. If everything is fine, you can just reassure them. But in the woman of a reproductive age group, if she is not getting periods or the periods are very scanty, the first thing to be ruled out is that she is not pregnant, because sometimes a tubal pregnancy may present with an abnormal scanty periods that comes in during the dates, and then she might have some lower abdominal discomfort. That could be a first sign of tubal pregnancy, and if it goes unrecognized, it can be very catastrophic. Then other causes, as I mentioned, the fibroids and dysfunctional uterine bleeding. And in an elderly woman, when she comes with bleeding, we have to always rule out the cause for malignancy, especially when it is a postmenopausal woman. When she is coming about 1 year after she has stopped the menopause and she has had no menopause, and then she comes with some irregular spotting. The first thing we have to do is we have to rule out malignancy.
But what are generally the preventive measures a woman should take?
There are certain preventive measures which a woman should take. The pap smear test. I know everybody is familiar with the pap smear test. Comes out in all magazines, all medias, everything. But it is seldom followed up in the developing countries. In the developed countries, we have a strict schedule for taking the pap smear test. The pap smear test should be taken. It is in the pap smear test we are studying the cells removed from the cervix. Cervix is that part of the uterus which can visualize through the vagina. And when the cancer of the cervix develops, it doesn't develop all of a sudden. First, there will be certain changes in the cells, and these changes gradually progress on to become cancer. So, when these changes are detected in the early stage by this, which can be done by the pap smear test, there are curative methods for that. So, that is one test which all women in the reproductive age group, sexually active women should have. It should be done ideally yearly or at least once in 3 years, and the most common cause for this is the human papillomavirus infection. Then another test which they should do is that Every woman, I think after 40 they should have a mammogram done because cancer of the breast is on the increase, and also this routine scanning because the uterus and the ovaries to detect if there are some any abnormalities there, and if some findings there, they should definitely have a gynae consultation done. And other than mammogram, monthly once everybody should do a self breast examination, so that if they detect any small lumps or so, they can consult the concerned doctor and take the treatment if needed.
So, what are the general health tips that you can advise to you?
They not to care much for their body because they don't have time. It is they are concentrating more on the family. But one thing I would say is that women should remain healthy to look after the family. So to remain healthy, the woman should eat right. She should have correct exercise. She should do exercise, and she should maintain a regular checkup so that she remains healthy. Exercise can be in the form of a walking for about half an hour, or another aerobic exercises, or any form of exercise which will suit her. And regarding food, there is a certain tendency that they tend to eat all what is left behind. We should never think that our stomach is a waste paper basket, and you should limit your food. You should take food in such a way that you eat plenty of vegetables, fruits, and cut down on sugars after a certain age. Because obesity is a growing problem in anywhere you take, you find a lot of obese people, and obesity has its own health hazards also, like diabetes, hypertension, heart disease. So maintaining the correct weight, taking the correct food, drinking plenty of water, and doing regular exercise is what will keep a woman healthy.
Doctor, do you advise any kind of diet or any particular food that has to be avoided, especially for women?
Food to be avoided, as everybody knows, is the junk food and also the soft drinks, because they contain a lot of things that are detrimental to health. And the homemade food is definitely much better than any of this food which you get from outside. And also the fried foods that should be avoided. And as far as the woman is concerned, it should start from the childhood itself. Even for the girls, you should give the food in such a way that they are not overweight from childhood onwards. And so much depends upon the diet they eat. And for sweets, should cut off on sweets, because sweets have a tendency for you to put on weight a lot.
Doctor, what are your particular interests related to your profession?
Even though my profession keeps me very busy, I find time and find pleasure in taking awareness classes for women of all age group. I would say even to school children, adolescent girls, to the women of the reproductive age group, and also for the postmenopausal women. I also conduct medical camps, awareness camps, and cancer detection camps, pap smear camps. These are all, I find it all very useful, because most of the cases when you conduct a pap smear camp, most of the cases come out as normal, but still, even if it is the one case that is detected, it is really worth it. Another very common problem of today is the polycystic ovarian syndrome. It is a lifestyle disease, and we should start the prevention should start at a very early age. It is when the child is during the childhood itself, and the prevention is in the form of exercise and the correct diet. I would advise all mothers to take this point. And one piece of advice to all ladies is that whenever you have any problem, don't hesitate or don't just keep on postponing, because your health is also of prime importance. Starcare is a premium hospital with a JCI accreditation, and I find it has got the state-of-art facilities for all investigations and management. It has got a very good theatre setup for laparoscopic surgeries, and also a very good obstetric department.
Doctor, it is an absolute pleasure to have you with us, and we thank you so much for that interactive session. Thank you very much.